Picture this. You wake up tomorrow morning and something has changed. That confident, firm hardness you remember from years ago is back. Not because you swallowed a pill, not because you bought some expensive device, and not because you had a procedure done. Just from a few minutes of focused touch you applied to your own body before bed. No doctor visits, no embarrassing conversations, no waiting for prescriptions. Just your hands, specific points on your body, and a method so simple, you'll wonder why nobody told you about this sooner. What if I told you that the secret to bringing back those automatic morning erections isn't locked behind a prescription pad or hidden in some exotic herb from the other side of the world? What if the solution has been right there, literally in your own hands, this entire time? Right now, while you're reading this, there are 3 specific spots on your body that, when activated correctly, can restart the entire erection mechanism that's been slowly shutting down. These aren't random points. These are precise locations where nerves converge, where blood vessels cluster, and where your body's natural systems can be awakened from their dormant state. Think about the last time you woke up with a strong morning erection. Maybe it was months ago, maybe years, maybe so long ago, you've started to accept that those days are simply over. You've probably told yourself it's just age, just stress, just life. But what if that's not the complete truth? What if your body hasn't forgotten how to create those erections at all? But instead, the pathways have just gone quiet, waiting for the right signal to wake them back up. That's exactly what's happening inside you right now. The machinery is all there. The blood vessels, the nerves, the muscles. Everything you need is still present and functional. It's just sitting there, idle, like a car that hasn't been started in months. And just like that car, all it needs is the right ignition sequence. Here's something most men don't know. Morning erections aren't just random biological events that happen by chance. They're not lottery tickets your body hands out less frequently as you age. They're the result of a specific, measurable process involving nerve signals, blood flow patterns, and muscular responses that work together in perfect coordination. When that coordination breaks down, when the signals get weaker, when the blood flow slows, that's when those morning erections start disappearing. But here's the crucial part that changes everything. That breakdown isn't permanent. It's reversible, and you can reverse it starting today with nothing more than deliberate pressure applied to 3 key points. The reason this works comes down to basic anatomy and physiology, but explained in a way that actually makes sense. Your penis gets hard through a process that involves your brain, your spinal cord, specific nerves, blood vessels, and a group of muscles you probably didn't even know existed. When arousal happens, nerve signals travel down from your brain and spinal cord to the penis. These signals tell the smooth muscle tissue inside the penis to relax. When that muscle relaxes, blood can rush into 2 chambers called the corpora cavernosa. As these chambers fill with blood, they expand. As they expand, they press against the veins that normally drain blood away. Those veins get compressed, trapping the blood inside, and that's what creates the firmness and rigidity of an erection. Now here's where age comes into play, and why this matters. As decades pass, several things start happening simultaneously. The nerve signals that travel to your penis become slower and weaker. It's like the phone line getting more static on it every year. The blood vessels that carry blood to your penis lose some of their flexibility. They get stiffer, narrower, less responsive to the signals telling them to open up. The smooth muscle inside your penis becomes less sensitive to the chemical messages telling it to relax, and the pelvic floor muscles that help support the erection process lose tone and strength. All of these changes happening together create the perfect storm for morning erections to fade away. But every single one of these problems has a solution, and that solution doesn't require medications that come with side effects, or devices that feel clinical and awkward, or supplements that may or may not work. The solution is strategic stimulation of specific pressure points that directly address each part of the erection mechanism. When you apply pressure to these exact locations, you're doing several things at once. You're stimulating sensory nerves that send signals back through your nervous system, essentially reminding your body how this process works. You're increasing local blood flow to the tissues that need it most. You're activating reflex pathways that connect directly to the erection centers in your spinal cord. And you're engaging the pelvic floor muscles that provide structural support for maintaining firmness. Think of it like this. Your erection system has been running on low power mode for years. The lights are dimmed, the machinery is slow. Everything is just barely functioning at minimum capacity. What these pressure points do is flip the switch back to full power. They wake up dormant nerve endings. They open up narrowed blood vessels. They remind muscles how to contract and relax properly. And they do all of this naturally, using your body's own built-in mechanisms, not by forcing something artificial into your system. The first location you need to know about sits right where your penis meets your body. Run your fingers along the underside of your shaft, following it back toward your pelvis. You'll feel a spot where everything seems to hinge, a slight depression or groove where the shaft connects to your body. This isn't just skin and surface tissue. Beneath this exact spot lies a critical junction where major blood vessels enter the penis and where dense clusters of nerves converge. This is ground zero for your erection response. When you stimulate this area correctly, you're essentially hitting the master switch that controls both blood flow and nerve signaling right at their source. The technique for working this first point requires precision and patience. Take your thumb and place it directly on that groove where shaft meets body. Use your other fingers to support the back of the shaft, creating a stable grip. Now apply slow, deliberate circular pressure with your thumb. The pressure should be firm enough that you can feel the tissues responding underneath, but it should never cross into pain. This isn't about forcing anything. It's about creating sustained, focused stimulation that allows blood to pool in the area and nerve endings to activate. Move slowly. Let warmth build under your thumb. You might feel tingling. You might feel a subtle pulsing sensation. You might even feel a gentle swelling response as blood flow increases in real time. When you first try this, you might not feel much at all. That's completely normal and actually expected. Remember, these nerve pathways have been quiet for a while. They need to be retrained. They need repeated stimulation before they start responding strongly again. Think of it like physical therapy after an injury. The first few sessions don't produce dramatic results, but with consistent practice, the response gets stronger and more reliable. Start with about 90 seconds on this point. Do it once per day. The best times are in the morning when your body is naturally relaxed and your testosterone levels are highest, or during a warm shower when heat is already enhancing circulation throughout your entire body. Daily consistency is absolutely critical here. Doing this once or twice and giving up won't produce results. Doing it intensely for a week and then stopping won't work either. What reconditions both the vascular system and the neural pathways is steady, repeated stimulation over time. You're literally teaching your body to respond again, and that teaching requires repetition. The second location most men have never even thought about in relation to erections, but it's actually one of the most powerful points you can activate. It's called the perineum, and it's the soft area of tissue between your scrotum and your anus. If you press gently into this area, you're actually pressing against a muscle called the bulbospongiosus, which is part of your pelvic floor. This muscle has a very specific job. It helps trap blood inside your penis once an erection forms, keeping it firm and rigid. When this muscle loses strength and tone, which happens naturally with age and inactivity, your ability to maintain erections weakens significantly. Blood flows in but doesn't stay trapped as effectively. Erections become softer, less sustainable, more likely to fade during activity. Stimulating the perineum does something remarkable. It activates these pelvic floor muscles reflexively, essentially giving them a workout while simultaneously improving blood flow to the entire region. This dual action of muscular activation and circulatory enhancement makes this point incredibly effective for restoring erectile function. The technique requires you to be comfortable and relaxed. Sit or recline with your legs slightly apart so you can easily access the area. Use your index and middle fingers, or even the heel of your hand if that's more comfortable, and press firmly into the center of the perineum. The pressure should feel substantial but pleasant. Move in slow, deliberate circles, maintaining consistent pressure throughout the motion. You're looking for several sensations here. You might feel warmth spreading from this point up toward your shaft. You might feel a rhythmic pulsing as blood flow increases through the area. You might even feel the muscle itself responding beneath your fingers, contracting and releasing in response to the stimulation. Spend 2 to 3 full minutes working this point. Keep your movements intentional and controlled. Don't rush. The effectiveness comes from sustained stimulation, not from speed or intensity. To maximize the benefit of working this second point, follow the massage with direct pelvic floor contractions. These are similar to Kegel exercises, if you've heard of those. Contract the muscles you would use to stop urination midstream. Hold that contraction for 3 to 5 seconds, feeling the muscles tighten and lift. Then release completely and let everything relax. Repeat this several times. The massage you just did primed these muscles, waking them up and increasing blood flow to them. Now the contractions build actual strength in those muscles, improving their ability to trap blood and maintain firmness during an erection. Over time, this combination of massage and contraction creates significant improvements in erectile rigidity and sustainability. The third and final point is located on the penis itself, at the raised ridge where the head meets the shaft. This ridge is called the corona, and it contains an extraordinarily high concentration of nerve endings. In fact, this is one of the most nerve-dense areas of the entire male body. Why does that matter? Because stimulating this area sends powerful signals through the nerve pathways that control erections. It's like sending a test signal through the system to make sure all the connections are working. When these nerve pathways are stimulated regularly, they maintain their sensitivity and responsiveness. When they're ignored, they become less reactive, less capable of transmitting the signals needed for a full erection. Working the corona requires a gentler touch than the first 2 points because of how sensitive this area is. Position your thumb on one side of the corona and your forefinger on the other, creating a gentle pinch around that raised ridge. Hold this light pressure for about 5 seconds, then release. Repeat this hold and release pattern for about a minute. You're not squeezing hard. You're applying just enough pressure to engage the nerve endings without overwhelming them. After the pinch and release sequence, switch to slow circular motions around the corona, using your thumb and forefinger to trace that ridge all the way around. Continue this for another minute or so, maintaining steady, moderate pressure throughout. The key with this third point is that gentle, consistent stimulation works far better than aggressive pressure. This area is so densely packed with nerve endings that too much pressure or too much friction can actually overload the nerves and temporarily reduce sensitivity rather than enhancing it. You're aiming for careful retraining of sensation here, teaching these nerves to respond strongly to appropriate stimulation. If at any point the sensation becomes too intense or borders on uncomfortable, lighten your touch immediately and slow down your movements. Now let's put all 3 of these points together into a complete daily routine that you can actually implement and sustain. Start with the base groove. Apply 90 seconds of slow, circular pressure with your thumb, feeling the warmth build and the tissues respond beneath your touch. Move to the perineum next. Spend 2 full minutes with firm circular massage on this point, followed by several pelvic floor contractions to engage and strengthen those supporting muscles. Finish with the corona, 1 to 2 minutes of gentle pinch and release, followed by light circular touches around the ridge. The entire sequence takes about 5 to 7 minutes. Once you're familiar with the movements, perform this complete routine once per day. The ideal time is in the morning, either right after waking or during your morning shower. Morning is when your testosterone levels are naturally highest and your body is in a relaxed state. If morning doesn't work for your schedule, the evening before bed is your second best option. The warm water of a shower is particularly helpful because heat naturally dilates blood vessels and makes tissues more responsive to stimulation. If you're doing this in the shower, the warmth is doing half the work for you, making the stimulation even more effective. Consistency matters more than intensity here. You're far better off doing this routine gently every single day than doing it aggressively 3 times, and then skipping the rest of the week. This isn't about forcing dramatic changes overnight. This is about steady, incremental conditioning of your vascular system, nervous system, and muscular system. Each daily session builds on the previous one, gradually strengthening the pathways and responses that create strong, spontaneous erections. Don't expect immediate, dramatic results after your first session or even your first week. Your body needs time to adapt and respond. The changes you're creating happen at a cellular and systemic level. Blood vessels need time to regain flexibility. Nerve pathways need repeated stimulation before they return to full sensitivity. Muscles need consistent engagement before they rebuild strength and tone. Most men start noticing subtle changes within 2 to 4 weeks. These early changes might be small things, like more warmth in the pelvic region after the routine, occasional slight fullness in the morning that wasn't there before, or improved firmness during regular arousal. These small signs indicate the process is working and the systems are beginning to respond. More substantial and lasting improvements typically appear after several months of continued, consistent practice. This timeline varies, based on individual factors, like your baseline circulation health, the current state of your nerve sensitivity, your overall lifestyle habits, and how consistently you perform the routine. Some men see faster results. Others need more time. The objective isn't instant transformation. The objective is steady, measurable enhancement of the 3 critical systems involved in erections: nerve signaling, vascular flexibility, and pelvic muscle support. Safety and hygiene matter significantly when you're working with these sensitive areas. Keep your fingernails trimmed short and filed smooth, so there's no risk of scratching or irritating delicate tissues. Always wash your hands thoroughly, both before and after performing this routine. If you're concerned about hygiene or have any skin conditions, you can wear thin gloves during the process. Never apply pressure to any areas with open sores, cuts, active irritation, or recent surgical sites. If you experience sharp pain at any point, notice any bleeding, develop ongoing swelling that doesn't resolve, or experience numbness that persists after stopping, pause the routine immediately and consult with a healthcare provider. Men who take blood-thinning medications or have bleeding disorders need to be particularly careful with the amount of pressure they apply. Use gentler pressure than described and check with your doctor before starting this routine. Men with diabetes, vascular diseases, or recent pelvic surgeries should also speak with a urologist before beginning. These conditions can affect how your tissues respond to pressure and whether this type of manual stimulation is appropriate for your situation. Understanding how this routine creates change helps maintain motivation during the early weeks when results aren't yet obvious. These techniques work through 2 distinct but complementary mechanisms. The immediate mechanism is sensory and circulatory. When you apply pressure to these points, you're directly stimulating sensory nerves while increasing blood flow to the area. This immediate effect helps initiate an erection response. The long-term mechanism is adaptive and restorative. Consistent, repeated practice retrains your pelvic reflexes, enhances the flexibility and responsiveness of blood vessels, and rebuilds the strength of supporting muscles. These long-term adaptations are what make getting and maintaining erections progressively easier over time. Think of the process as systematically re-educating your body's natural responses through patient, repeated stimulation. You're not adding anything foreign to your system. You're not overriding your body's natural processes with chemicals. You're simply reminding your body how this system is supposed to work and giving it the repeated practice it needs to restore full function. You can enhance and accelerate the results from this pressure point routine by supporting it with complementary daily habits. Proper hydration is essential because blood is mostly water. An adequate hydration maintains blood volume and flow efficiency. Aim for consistent water intake throughout each day, not just when you're thirsty. Pelvic floor exercises beyond what's included in the routine provide additional strength training for these critical support muscles. Simple Kegel contractions performed throughout the day, even briefly while sitting or standing, build muscular endurance that directly translates to better erectile function. Nutrition plays a significant role in vascular health and hormonal balance. A diet rich in vegetables, fruits, whole grains, lean proteins, and healthy fats provides the raw materials your body needs for optimal blood vessel function and hormone production. Cardiovascular exercise is particularly beneficial because it strengthens your entire circulatory system, improves heart function, and enhances blood flow throughout your body, including to your pelvic region. Even moderate activities like brisk walking, swimming, or cycling for 30 minutes most days creates measurable improvements in vascular function. Sleep quality affects hormone production and nervous system recovery. Poor sleep disrupts testosterone production and impairs nerve function, both of which directly impact erectile capability. Prioritize consistent sleep schedules and adequate sleep duration. Stress management is equally important because chronic stress elevates cortisol levels, which interferes with testosterone production and restricts blood flow. Whether through meditation, breathing exercises, physical activity, or other stress reduction techniques, managing daily stress supports every aspect of sexual function. Some men choose to explore supplements that support circulation and sexual performance alongside this physical routine. Two options mentioned frequently in men's health discussions are organic watermelon extract and comprehensive herbal blends. Watermelon extract is rich in an amino acid called citrulline, which your body converts to another amino acid called arginine, which then supports nitric oxide production. Nitric oxide is the molecule that signals smooth muscle in blood vessels to relax, allowing them to dilate and increase blood flow. This is actually the same mechanism that prescription medications for erectile dysfunction utilize, just through a natural dietary source rather than a pharmaceutical one. Comprehensive herbal blends often include ingredients like tonkat ali, fenugreek, nettle root, and additional citrulline. These combinations are designed to support multiple aspects of male sexual health: testosterone levels, stamina and energy, erection quality, and prostate wellness. If you choose to explore supplements, always select products from reputable manufacturers who provide third-party testing and quality verification. More importantly, discuss any supplements with your healthcare provider before starting, especially if you take any medications or have existing health conditions. Supplements can interact with medications and may not be appropriate for everyone. As you begin implementing this daily routine, start with the session durations exactly as outlined. As you become more comfortable with the techniques and as your tissues adapt to the stimulation, you can gradually extend the duration in small increments. However, avoid the temptation to dramatically increase pressure or duration thinking it will speed up results. Too much pressure or excessively long sessions can actually cause tissue irritation and set back your progress. The goal is calm, consistent conditioning, not intense effort that risks causing problems. If sensation feels minimal or absent during your first several sessions, resist the urge to press harder. Instead, lighten your pressure and give your nerves time to gradually increase sensitivity. Nerve tissue that hasn't been regularly stimulated needs time to wake up. Pushing too hard too fast can cause temporary numbness, as the nerves become temporarily overwhelmed and shut down their response. Whenever you experience any discomfort during the routine, stop immediately and allow the area to fully recover before resuming. If irritation persists beyond a day or two, seek medical guidance rather than continuing to aggravate the tissues. If you have diabetes, cardiovascular disease, peripheral vascular disease, nerve damage from any cause, or have had any pelvic surgeries, including prostate procedures, hernia repairs, or bladder surgeries. Consult with a urologist before adopting this routine. These conditions can affect tissue sensitivity, blood flow, and how your body responds to manual stimulation. A urologist can provide personalized guidance on whether this approach is safe for your specific situation and whether any modifications are needed. If you perform this routine consistently for 8 to 12 weeks and notice absolutely no changes whatsoever, or if new symptoms develop such as pain, numbness, unusual discharge, or skin changes, schedule a proper medical evaluation. A complete absence of response after consistent practice might indicate underlying vascular or neurological issues that need professional assessment and treatment. Similarly, new symptoms could signal a condition that requires medical attention rather than continued self-treatment. It's important to understand that a reduction in spontaneous morning erections can sometimes indicate cardiovascular problems that extend beyond just sexual function. Erectile dysfunction is often an early warning sign of heart disease because the blood vessels serving the penis are smaller than those serving the heart, so they show narrowing and reduced function earlier. If you're experiencing erectile changes, along with other symptoms like chest discomfort, unusual shortness of breath, extreme fatigue, or leg pain with walking, these combinations deserve prompt medical evaluation, regardless of whether this routine helps. You don't have to accept declining morning erections as an inevitable, unchangeable consequence of aging. The biological systems that create erections remain present and capable of function throughout life. What changes is their efficiency and responsiveness, and those qualities can be restored with the right approach. By carefully practicing these 3 pressure points every single day, you're directly addressing the root causes of erectile decline. You're reactivating quiet nerve pathways. You're improving flexibility in narrowed blood vessels. You're rebuilding strength in weakened pelvic muscles. This approach works because it's based on solid physiological principles about how erections actually happen and what causes them to fade. It doesn't rely on temporary chemical fixes that wear off in hours. It doesn't depend on devices that work only while you're using them. It creates lasting improvements by systematically restoring your body's natural capabilities. The hands doing the work are yours. The body being improved is yours. The results you build are entirely your own, created through patient, consistent practice of techniques that directly target the mechanisms that matter most.